Hello, my good people. How are you doing today? Dominic here, and welcome to my Healthy Talk. So today we want to talk about something. Today we want to talk about complications during pregnancy, or pregnancy complications. So if you are a pregnant woman, if you are expecting a baby, if you are planning to, conceive, this information for you. And this information is not for only women, even for men, because you also need to know what can happen, what precautions you need to take, especially when your wife or your spouse is pregnant. So there are very many complications that can happen during pregnancy, but I'm going to talk about 14 main complications during pregnancy. Apparently, pregnancy is a beautiful thing because you're preparing, you're going to have your baby, you're going to have your bundle of joy. But then, pregnancy, nevertheless, may come with different challenges. Some of them might be very dangerous. So welcome, and let's talk about these pregnancy complications, right? Right. So basically, as I've said, we are going to talk about 14 main complications during pregnancy, right? Yes. So one of it, or number one, is what we call ectopic pregnancy. Ectopic pregnancy, this is a pregnancy outside the uterine cavity. It can be most of the time in the fallopian tubes, but in rare cases it can even happen in peritoneum. So in most cases it happens in the fallopian tube. That is what you call ectopic pregnancy. And in most cases this is a condition that can lead into, it's an emergency, because somebody may need to do what you call laparoscopy or laparotomy to get rid of that pregnancy because it cannot progress. So it normally presents with severe low abdominal pain and even bleeding, especially the first few weeks of pregnancy, up to around 6 weeks. So if the pregnancy, if you experience very severe abdominal pain, especially it could be one-sided, depending on which part of the, or which side of the fallopian that has the ectopic, you may have the pain on the left side or on the right side. So that is one. Number two is what we call rhesus incompatibility. I talked about this sometimes back. Rhesus incompatibility, we mean when a pregnant woman is rhesus positive in his, or rather in her blood group, and or rather she is rhesus negative, and she carries a baby who's rhesus positive. So for instance, if you are rhesus negative blood group type O, and you happen to carry a baby who's rhesus positive, maybe from the father, if the father is rhesus positive, you may have such kind of incompatibility. It could lead to miscarriage, it could lead to hemolytic disease of the newborn, it may lead to anemia. There are different complications that come about as rhesus incompatibility. That is number two. Number three is what we call miscarriage. Miscarriage is basically loss of pregnancy after the 20 weeks of pregnancy. So most of the time you may not know exactly what could be the cause of miscarriage, but that is one of the complications. Number four is what we call hyperemesis gravidarum, right? This is basically excessive vomiting during pregnancy. It's very normal to have some vomiting and nausea during pregnancy, especially the first trimester. But when it happens in a way that you are not able to retain anything orally, then that is now a complication we call hyperemesis gravidarum. That was number four. Number five is what we call preeclampsia. Preeclampsia basically, this one means high blood pressure during pregnancy. So in normal circumstances, your pressure should not be high during pregnancy, unless maybe you are hypertensive. But if you are not a non-hypertensive person and your pressure shoots in pregnancy, it leads to what we call preeclampsia, which is basically high blood pressure during pregnancy. And this, if not controlled, can lead into another complication that we are looking at next, that is eclampsia. That's number 6. Eclampsia basically is now when this high blood pressure has become more complicated and it has developed into convulsions or seizures. So if you develop convulsions during pregnancy, it means now you've got what called eclampsia. So eclampsia is a very serious condition that it leads to a pregnant woman to be admitted, and if possible, if the pregnancy has reached term, it can be delivered, right? Another complication, that is number 7, is what we call gestational diabetes. Gestational diabetes, basically here we mean diabetes in pregnancy for a woman who was not pregnant, or rather who was not diabetic. So we do have instances where the blood sugars shoots high during pregnancy. That is now what we call the gestational diabetes. So we always advise that always check your blood sugar during pregnancy so that you are also able to know that your sugars are well. Also get to know those signs that it could be a leading symptom for gestational diabetes. Number 8 is what we call preterm labor. Preterm labor basically means when you get labor pains before term. Apparently that is below the gestation of around 37 weeks. If your labor pains comes before 37 weeks, that is now preterm labor. There are very many causes for preterm labor, but I'm not going to talk about them right now. Another complication, that is number 9, is what we call infections. So there are different infections that can cause or that can happen during pregnancy. Some of them we abbreviate them as TORCHES. TORCHES here we mean conditions like toxoplasmosis, conditions like sometimes UTIs, STIs that can happen during pregnancy. So those kind of conditions can actually even lead to miscarriage, lead to false labor, lead to preterm labor. So if you have any infection during pregnancy, make sure it's treated well. Number 10, the complication, we have what we call vaginal bleeding. Bleeding during pregnancy, actually you shouldn't bleed during pregnancy. Apart from, there is what we call implantation bleeding, which happens especially the first few weeks of pregnancy. But then if you bleed very much during pregnancy, even if it's spotting, bleeding is bleeding. Even if it's spotting, that is a danger sign during pregnancy, right? So it's better you seek help immediately. You just find out that you are bleeding in pregnancy. It could be that you are miscarrying, or there is a problem that has happened with your baby. Another complication, which is actually one of the even causes of bleeding, is what we call placenta abruptio and placenta previa. Placenta previa basically is where the placenta is not well situated where it should be. That is low-lying placenta. That is placenta previa. So basically there are degrees, all how it is. Apparently the placenta should be not be so low-lying or just near the cervix. So if you have your placenta, maybe through the ultrasound scan, and you find that your placenta is low-lying, then that is a problem. It can lead into bleeding. Placenta abruptio, this is where the placenta detaches from the walls of the uterus. So this can lead into a baby not getting the nutrients. So apparently that can be a big problem. We also have another type of complication related to placenta called placenta accreta, right? So another complication, that is number 12. Yes, there is what we call low amniotic fluid, what we call oligohydramnios, right? Oligohydramnios, this is where we have low level of amniotic fluid. Remember, amniotic fluid is a fluid that cushions or protects the baby in utero or in the uterus. So if it goes so low, it means the baby may not be protected, and that baby may be born into infections, right? Another complication, that is number 13, second last, depression and anxiety. Sometimes pregnancy can be so demanding. It can have, it may come with emotions and all that. That is normal because of hormonal changes. But then it may complicate into depression and anxiety. So where you find someone is not having any peace of mind, extreme sadness and all those, that one can be a problem. Sometimes it can be even after the pregnancy, after delivery, that is. Yes. Another complication, that is the last, is what we call anemia. Anemia basically is low level of blood. Yes. In pregnancy, it's normal to have low level of blood due to, there is a diversion of blood into the fetus. There is what we call hemodilution. Yes, blood level goes low. That is why women who are pregnant are advised to take those supplements to boost blood in their level, or rather in their system, right? So basically, those are 14 main complications during pregnancy. There are very many of them that I couldn't mention of them, but those are the main that we could talk about, right? Thank you for listening. Next on my episode, I'll be talking what we call danger signs in pregnancy. As a pregnant woman, you need to know what's normal and what's abnormal, right? Because pregnant sometimes, especially the first-time mothers, or those ones, we call them prime gravidas, that is, who are pregnant for the first time, sometimes they may not be able to know what is normal and what's abnormal. So that will be my next topic. Otherwise, thank you for listening. Thank you for watching Health is Wealth. Otherwise, keep on subscribing to my YouTube channel. Keep on following my Facebook page. Keep on following me on TikTok. Thank you, and may God bless you.